Hey there, in this video, let's talk about knee pain in elderly. Hi, welcome back to my channel. This is Elbu, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness and performance. So, in terms of knee pain in elderly, let's not talk about the rest of the things, right? Like muscle imbalance, which I usually cover, biomechanics. We're just gonna focus on one thing, and the difference between an elderly and a usual adult like myself. The key difference is that they actually live longer than most of us. Okay, and this basically just translates to spending more time than most of us, right? So the key factor over here is time. And if we just look at time, we got to understand how time plays a part and it affects the body, right? A lot of elderly think that it's because of the time that they have spent doing their things, their stuffs, it causes wear and tear. Now, wear and tear, it's you can think about it more like a result of something that is happening to your body, and then it causes wear and tear. This wear and tear is the equation of what's happening. Not all elderly suffer from pain because of wear and tear. So you got to be clear on this. Okay, there are many elderly that doesn't have knee pain because of wear and tear. Okay, so wear and tear is clearly just because of time, and it causes it. So what happened to your body over time? Okay, so over here we're just gonna focus on one thing. Again, just one thing, because there are just too many things to talk about. And this thing basically, as you age, you will also feel it because it happens over time. And you will slowly feel it because you know that there are certain things that you can do in the past, but you can't do right now. You can't perform anymore because you have lost it. And this thing is basically strength. And what I want to show you is basically a graph that shows strength loss over time. So what you're seeing here is basically a graph that shows the muscle strength and our age. Okay, so it's basically divided into three different phase of our life, right? So early life, as a baby, as a teenager, we can actually grow in strength because the body is actually growing, right? So even for most people, even they're not doing any resistance training or much of a exercise, this is the part of life where you just have to eat normally. The strength will come because your muscle is growing. Okay, so comes somewhere around 20ish, we will reach our peak. Okay, so this is where if you don't do anything, at the start of adult life, we don't feel as much. We still feel okay. And then when comes 30s, 40s, this will start to drop. Sorry, this is something else. This is the normal kind of graph. If you don't do any resistance training, nothing is being done, no strength training involved, this is gonna happen. Okay, so we'll peak, and then by 20s, 30s, it will start to drop, and then by 40s, 50s, 60s, and it will just keep dropping. Okay, without you doing anything. But when there's some strength involved, this is basically a range. Okay, some people can be following this way, and they're here. Okay, some people could be over here, they maintain, and they just go straight line. So it really depends, right? The program that you are doing, or what you are doing to your body. What I'm showing you is that if you're not doing anything, this is the phase that it's going to happen, and it happens to a lot of people. What I commonly hear from people is that they don't want to get themselves injured because of doing exercise. That can be understood, because with any exercise, any physical activity, there comes a risk of getting injured, right? But the matter of fact is that if you don't exercise, you don't do anything, you're going to lose strength. And this is just strength that we're talking about. We haven't looked at or even think about what are the consequences of not having strength. Without strength, you see, over here, what this is saying is basically low physical performance. Once you get there, it's to the point where it becomes very difficult for you to be physically active. I understand about the pain from injury and from exercise and all this, but this phase of life where you get, right, is basically people, because of pain, they'll be on crutches, they'll be on wheelchair, they don't want to move, just simply because they're feeling pain. And the reason is because they don't have the strength compared to a lot of others who may be over here, right? So they actually fall into this part and slowly even get into this part. It depends, right? Everybody has got a different a chart and different things that they want to do in life. The quality of life is definitely going to be affected. Like, for example, playing with your grandchildren, you can't do it. You'll be on wheelchair, you can't be physically with them, you can't go out with your friends as easy as, you know, the past, because you'll be on wheelchair, you don't even want to go out, you know, those are the things. So different factors, you know, that gets involved. How much you want to socialize with people, the places that you can go, probably travel around the world after you retire. So, you know, there are different things to consider. If you keep yourself, if you maintain your strength just above here, right, not getting yourself into trouble over here, you basically can live life, retire without pain, right? That's the optimal, and that's where you want to be. So this is something that I want to show you in terms of the graph and the research that's being done. I'll link it in the description below, and you can read the article as well. So what you have seen is basically strength loss decreasing over time, and the only way to fight this, the only way to go against this, is basically trying to make sure that the slope, the gradient of this strength loss is basically bump up. In many cases, we can actually, depending on your age again, we can actually try to increase the strength if we have a proper program. Okay, so this is gonna happen, but what we can do is basically try to push this thing up such that you maintain the strength or you increase the strength. Okay, and again, there's nothing else that you can eat to gain strength. The only way to gain strength is to increase your strength, and this way, the only way is basically resistance training. And what you want to do is to have a proper program so that you can progress slowly. And let's just give you an example, right? If let's say you can only carry 5 kg for bicep curl, you don't want to be suddenly doing 20 kg, right, for bicep curl. That is almost not possible, because you're going to strain yourself, you're going to tear your muscle by doing so, right? So in terms of increasing with a proper program, you want to increase it slowly. Some people, they go by, you know, increasing by 5%. Some people, they go by increasing 1 kg at a time for their resistance training. Again, depending on different parts of the body, because we're talking about bicep curl. If let's say we're talking about squats or deadlift, 1 kg, it's not so significant, but it is also incremental, something that you may want to also think of. Also depends on the equipment that's available. And if I remember correctly, the smallest plates available is going to be 1.25 kg, right? So it really depends, depending on who's guiding you and which program you buy or who are you following. But in the gist, you want to be focusing on resistance training, weight training, because that's going to help you increase or preserve your strength. And with strength, you're not going to overload your body so much, which causes wear and tear and causes pain. Okay, so this is something that's very different from elderly versus young adults, right? So you got to be aware of, if you're an elderly, you got to be aware of what's happening to your body, what you can do. Of course, the different tests, the different things to make sure that you know what's happening to your body. But this thing that you saw, this graph, it's gonna happen anyways, right? So take this into consideration. Make sure that you know this at the back of your mind. Once you sorted out the rest of the things, you're still gonna come back to strength training, because that's gonna help you in a lot of different ways, right? Because if you have knee pain, you can't do almost anything, right? Walking can be painful, jogging can be painful, sometimes swimming can be painful, right? So once you sort that out, you can actually be more productive in getting back to your fitness, right? So that's all I have for you in this video. Please take care. If you have any questions, if you have any comments, do leave them in the comment section below. And don't forget to check out the rest of the videos that has got to do with knee pain, because this is going to help you a lot. Alright, so if you like this video, don't forget to give me a thumbs up, a subscribe, and to hit the bell notification button, because once I post a new video, YouTube will notify you, and this is going to help a lot in this channel. Alright, so please take care. I will see you in my next video.